NHS Tower Hamlets Clinical Commissioning Group is a new organisation made up of 36 GP practices. In 2010, the government introduced radical changes within the NHS, and at the heart of these reforms was the setting up of clinical commissioning groups, also known as CCGs. The new commissioning groups will take over the responsibility of planning, monitoring and paying for local health services from the previous organisations, called primary care trusts. The aim is to give clinicians more control of the NHS and its resources, allowing GPs and practice nurses to improve the quality of services by using their local knowledge and experience of patients' needs.
In the past, doctors weren't really involved in the decisions that were made about how services were provided for patients. That's what's new now. Doctors and managers are working together to make decisions about how to provide services for patients.
The aim is to provide a better patient journey and a better patient experience. GPs tend to see their patients much more frequently than hospital doctors, and our community teams tend to have a lot more contact with the patients through the process of diagnosis and treatment. Therefore, we're in a great position to actually identify the needs of those patients along that whole journey, from diagnosis to treatment to aftercare.
From the 1st of April 2013, NHS Tower Hamlets CCG will be responsible for commissioning most of the health services required by our local population. This will include traditional hospital care, such as local A&E and planned operations, community care, such as district nursing and physiotherapy, mental health services and supporting those with continuing care needs. The CCG will work closely in partnership with the voluntary sector, Tower Hamlets Council and patients to commission their services.
One of the great advantages of involving GPs in particular in the commissioning process is a GP like me will see something like 50 patients a day. So actually what the information you get from patients about what they think about services, what sort of services they want, is absolutely a gold mine.
We've always said we need better relationships with the GPs, we need to work very closely with GPs. So we feel the government initiatives about clinical commissioning and patient engagement is really important to us, because it's the sort of thing we've been wanting to do for ages.
Tower Hamlets has a diverse community with a young and growing population. Faced with a number of healthcare challenges, we've introduced many projects over the last year to improve patients' care, and are excited by what we can achieve in the future.
Although we're a new organisation, we have achieved a number of things in the last few months, particularly around making sure people get the right treatment at the right time in the right place. And good examples of that is for those people who've got diabetes, heart failure, as well as mental health problems that can be treated in the community rather than secondary care.
I think our aspirations for the future as a CCG is to have a really big impact on the health of Tower Hamlets. And that's not just in terms of the traditional health services that we've provided, but also looking at the wider health and well-being of the whole population of Tower Hamlets.
If you're a patient or member of the public and would like to be involved in commissioning services, or a local clinician, we're keen to hear from you.